COVID has had a devastating impact on minority communities. When you add that to the federal government's history of experiments and disregard for the health of African Americans, there's a lot of skepticism surrounding the vaccine.
What makes you nervous about the vaccine rollout?
Because, for one, we don't know if it's going to be acceptable to everybody's body, where everybody's immune system be able to take it. Two, we don't want to be just like guinea pigs, just as test dummies or anything like that.
But Black doctors are stepping up to show their community the process is safe and could save lives. I'm joined now by Dr. April Lockley, who took part in the AstraZeneca trial. That vaccine has not yet been authorized for use. She's a fellow with Physicians for Reproductive Health. Dr. Lockley, so happy to have you with us. I want to talk to you about this research. A Pew Research poll shows 57% of Black Americans say they won't take the vaccine, despite the CDC saying Black Americans are almost 3 times more likely to die from the virus. Talk to us about why it was so important for you to take part in the AstraZeneca trial.
Great, thanks for having me. So my first thought in regards to being a vaccine trial participant, I really thought about the fact that I do believe in science. And so I signed up for the vaccine trial back in the summer. And by the time I received a call asking if I was still interested in being in the trial, all the vaccines had gone through phase 1 and phase 2 testing and were in phase 3. So I felt confident about the safety prospects and that they had no major safety concerns at that time. But also keeping in mind the history of this country. And I'm sure there's many stories that we don't know about, but the stories that we do know about, such as enslaved Black women being used as experiments for gynecological surgeries, Henrietta Lacks cells being used without her consent, Black men being withheld syphilis treatment when we knew they were a cure. And even today in 2020, there's Black women getting sterilized and having hysterectomies without their consent. And those are just some of the public stories. And then, patients speak to me. Most of my patients are Black and people of color about how they feel as though the medical community doesn't always listen to them or treat them fairly. And so I thought about really all those facts, the facts that I do believe in science and that we do seem to think that the vaccine is safe, and the medical community does need to gain people's trust. And so due to this history of racism in medicine, I decided it would be an important step for me to take in advancing science, hopefully, as a physician and a Black woman.
Well, and there's been so much talk about trying to encourage minority communities to get the vaccine. But, doctor, whose job is it to build that trustworthiness? Is the onus on people who are skeptical, or rather the institutions that contributed to the skepticism?
Right. So I completely understand why people have questions and have vaccine hesitancy. I think that we need to meet people where they are if they're hesitant. The medical community and the government needs to earn back people's trust. And really, this doesn't happen overnight. And so I've been introducing the vaccine to my patients, just letting them know that I do think it's safe, that it is coming, in 2021 for the general public, and that I understand that if there are questions, they need to be answered. And so when I speak to my patients in general, when they come to me with a question or concern, I take a history, I listen to them, and then we come up with a treatment plan together. If they have questions about those treatment plans, I always encourage them to ask those questions. I encourage an open dialogue. And sometimes it takes many appointments, many months for patients to come around to that treatment plan. And I think we need to look at the COVID vaccine the same way, that it might take time to have these conversations with people.
Dr. April Lockley, first of all, thank you for what you do, and thank you for taking part in the trial. It is a true public service, and thank you for your time today. So appreciated talking to you.
Thank you.